Hello ladies and gentlemen, my name is Ryan Griffo and this is Health and Wellness. Today I'm honored to be joined here by Robyn VanDusen at Caring Hospice. Robyn, thank you so much for being with us today. My first question for you and for our viewers is, what is hospice?
Hospice is end-of-life care, Ryan. It is a team approach to someone who is in the last stages of their life. The team approach including the patient, the family, the doctor, nurses, social workers, chaplains, volunteers. And while many years ago, hospice used to be a purely clinical model and just symptom management, it's evolved into becoming a psychosocial and spiritual model as well.
Definitely. Now, who can exactly receive this care?
Someone that has a terminal diagnosis, that could be cancer, cardiac related, liver, kidney, any terminal diagnosis. They must have a prognosis of 6 months or less, and there's a small caveat that says if the disease follows its normal course. And we also need a physician's order in order to initiate the hospice care. Each diagnosis that they can come on for, whether it be the cancer or the cardiac, has its own set of criteria and eligibility that they need to meet.
Definitely. Now, who is generally involved in the whole entire process?
So the process starts with a referral. The referral can come from the patient's physician. It can come from, a lot of times we'll get a call from a family member asking, what is hospice care? Can my loved one receive hospice care? It can also come from where the patient resides, such as a long-term care facility, an assisted living, or an independent living type of environment. And once we get that initial referral, we make sure that we have a physician's order so that we can go ahead and begin to do the assessment process for eligibility.
Absolutely. And Robyn, can you discuss with us the hospice admission process?
Sure. As I said, first they need a referral, and we make sure that we have a physician's order. Once we have that and we determine that they do meet criteria, our social worker, our chaplain, and sometimes even our nurse will meet with the family, explain the hospice services, also meet with the patient, of course, explain the hospice services, explain the hospice philosophy, and discuss the different services that we can provide. Once all of that's agreed to, they need to sign consents allowing us to provide care, and then we do a physical assessment and begin to plan out their individualized plan of care.
Absolutely. So, Robyn, I understand that there is still a stigma about family members putting their loved ones in hospice care. How is that being addressed today?
I agree with you, Ryan. Many times, and I meet with families myself, they hear the word hospice, and you can see it in their face. They shut down, you see fear, you see worry. Sometimes people don't even want to talk about it, and you really need to pull them out. When I started hospice, working in the hospice industry 15 years ago, it truly was about death and dying. You didn't have people on for, very long. It was a clinical model. It was managing symptoms. Now I've seen it evolve to become a psychosocial, a spiritual model. Many times there's no symptoms to manage. It's getting them to understand and accept this journey and this pathway. One of my goals as a liaison for Caring Hospice is to get out there and educate the community. It's never too early to learn. Don't be afraid when you hear your loved one has to be on hospice. We've had young people on hospice, older people. We have 102-year-old patients. We have 30-year-old patients. And either way, it's a struggle and it's hard to accept. But if I can get out and educate the community that when you hear the word, don't shy away. Understand that we're here to provide comfort. We're here to provide dignity. We're here to provide support 24/7. We're here not just for that clinical need of the patient, but the support of the family. Sometimes we are working with younger people who have young children. So we're working with them to understand what death is and dying is. My goal is really to make a greater comfort level before they may ever need to face putting their family on hospice.
And is hospice available 24 hours a day, 7 days a week?
We are 365 days a year. Primarily the team that's assigned to the patient, the team being the nurse, the chaplain, the aide, the volunteer, the social worker. They primarily work 8:30 to 5 Monday through Friday. However, we have an on-call team that works after 5 and on weekends, holidays, every day of the year. So if at any time, day or night, the family or the patient should need something, they would call our 800 number. They'll always speak to a live person, and if need be, a nurse can come to see the patient. Sometimes it's not a clinical need, it's the family isn't coping well, or they need some psychosocial or spiritual support. So we also have chaplains and social workers that can come out and be with the patient and family.
Wow, very nice. And can you also discuss with us as well, how is hospice generally paid for?
Our primary source of payment is Medicare. We also receive payment through Medicaid and most private insurances. With the private insurances, each hospice has a contract with different private insurances. We do accept a lot of them here at Caring Hospice. And then sometimes there is private pay for hospice, but it is a Medicare benefit and it is a Medicaid benefit as well.
Very nice. And where can one receive these services?
They can receive it anywhere that they reside. So whether it be at their home, in an assisted living, in a long-term care / nursing home, an independent living environment or facility.
Oh, very nice. And finally for you, can you speak a little bit more about Caring Hospice and how is it unique to other hospice care facilities?
Sure. There's a lot of hospices just in the Philadelphia area. And very frequently families want to talk to a number of different hospices to see who's the best match. Each one still needs to fit the certain guidelines that are set forth. However, each one also has its individual things that make it unique. Caring Hospice was established in 1997. We're in Pennsylvania, New York, New Jersey, Connecticut, and Ohio. And we provide care, again, wherever the patient resides. We take a team approach, so it's not just the nurse and then the chaplain and then the social work. We all work together to make sure that we're providing the best possible services for them. And at the center of the care is really the patient and the family. So everyone's going to get an individualized plan of care, an individualized attention to what their needs are, whether it be equipment, the number of visits they get per week, who's visiting them, and when they're visiting them. Another thing that Caring Hospice has is the longevity of our staff. I just went to my 5-year award ceremony, and there were people that have been with Caring Hospice since we started, 10, 12, 15 years. So we really have incredible longevity with our team, and we work well together. We try and see all of our actively dying patients on a daily basis. Many times there's no symptoms to be managed, so it's not necessarily a clinical need. But the needs of the patient and the family may be psychosocial or spiritual, dealing with the fact that this is the journey on the final days of their life. So we support them daily when they're actively dying. With hospice care, you get bereavement support for 13 months. Unlike many of our hospices, we don't have a separate bereavement team. The chaplain that was involved with the care from the beginning is the one who's providing those services. And we provide it for the 13 months that they need it for, and we provide it either face-to-face, via phone calls, whatever it is that the family's most comfortable with. We also are a We Honor Veterans program. We partner with the National Hospice and Palliative Care Organization to be a more veteran-centric organization to better provide our veterans in the community.
Well, that sounds all brilliant. And Robyn, thank you so much for taking time out of your day to give us all about your experience and information about hospice care. We really do appreciate you.
Thank you, Ryan.
Absolutely. And for Health and Wellness, my name is Ryan Griffo. Thank you for watching.